Have you ever noticed darkening or thickening of your skin in your neck folds, underarm folds, thigh folds, or sometimes even your knuckles? This is just not cosmetic. It is a condition known as Acanthosis Nigricans, and this can indicate your underlying insulin resistance. Today, let us understand about how treating this condition early can prevent you from getting diabetes. Hi, this is Dr. Ravali Yalamanchili, Chief Dermatologist at Nea Dermatology and Aesthetics. Acanthosis nigricans, where there is darkening and thickening of your skin folds and also sometimes face and even the eyelid area, can look like a simple skin problem but actually indicates underlying insulin resistance, hormonal imbalance, sometimes PCOD and even diabetes. The problem is not just within the skin, it's actually a reflection of your internal health. Some of the conditions that causes Acanthosis nigricans include insulin resistance. This leads to stimulation of insulin-like growth factor in your skin, which causes excessive production of skin cells. Thereby, skin in certain areas becomes more velvety and thicker and dark. Number 2, PCOD. When you have PCOD, there is also insulin resistance along with it, which can lead to Acanthosis nigricans. Certain medications like contraceptive pills can worsen Acanthosis nigricans. And also, if you have some conditions like thyroid problems, all of this would lead to ultimately insulin resistance that skin reflects as having Acanthosis nigricans. Firstly, if you visit a qualified dermatologist or even endocrinologist for that matter, they might assess your insulin resistance, how your fasting blood sugar levels are, or if you have any other hormonal problems. If there is insulin resistance, here are some of the tips that you can follow to reduce the insulin resistance, which automatically reduces your Acanthosis nigricans. Firstly, controlling your insulin levels. This can be done mainly by having a good diet. If you're someone who follows an unhealthy diet, please shift it to a wholesome, healthy, balanced diet, and this helps in reducing your insulin resistance. Number 2, if you're obese or you have excessive weight, make sure you're calculating your BMI and try to reduce your weight by opting for physical activity and healthy diet options. Along with your lifestyle changes, having a simple skincare routine with a cleanser, sunscreen, moisturizer, and choosing products that have retinol and glycolic acid in it help reduce the pigmentation and thickening of your skin related to Acanthosis nigricans. In-clinic procedures like chemical peels with retinol or no-melonphenol can help reduce the acanthosis by removing the excess layers of your skin. This, when done under regular intervals and controlling your blood sugar levels and insulin resistance simultaneously, will give you a permanent result when it comes to the treatment of acanthosis. So when it comes to the management of Acanthosis nigricans, first is lifestyle changes. Second is taking some medications to control the insulin resistance if necessary. These have to be prescribed by your physician or endocrinologist. And thirdly, opting for some of the in-clinic procedures. If you have Acanthosis nigricans or if you're noticing any darkening in these areas suddenly or over a period of time, please visit a qualified dermatologist. Acanthosis nigricans is more than just a skin problem. It's your body's signal to tell you that there's an internal problem of insulin resistance. If this insulin resistance is not corrected, you can land up with diabetes. By addressing this insulin resistance, you can take control of your overall health. If you want to know more about Acanthosis nigricans and how to deal with it, please comment below. If you like this video, please share it with your friends and subscribe to my channel.